Hi dear friends, so today we are going to deal with the 10th model paper for PSC exam. Okay, so hope all of you have done all the 9 papers which is given in the playlist of eDental Formula YouTube channel. Okay, so let's go into the 10th model paper. So the first question is asking about the duct of parotid gland. The duct of parotid gland is crossing over masseter muscle and pierces which muscle? Okay, buccinita muscle, superior constrictor muscle, masseter or zygomaticus major. So the duct of parotid gland is crossing over the masseter muscle and pierces the buccinata muscle. Okay, option A. Second question, the tongue developing from which of the branchial arches? So the tongue is the greatest, strongest muscle in the body. So the tongue is developing from which branchial arch? From the 1, 2 and 4, 1, 2 and 3, 1, 3 and 4, 1, 2, 3, 4. All the 4 are involved. So the main branchial arches from which the tongue develops is 1, 3 and 4. Okay, option 3 is the answer. C is the answer. Okay, 1, 3 and 4. Tongue develops from 1, 3 and 4 branchial arches. Question number 3. Middle meningeal artery is a direct branch of which artery? External carotid artery or internal maxillary artery, superficial temporal artery or middle cerebral artery? The middle meningeal artery is a direct branch of internal maxillary artery. Option B. Question number 4. Infection spreading via the lymphatics from the lower lip first enter the bloodstream at the brachiocephalic vein, inferior labial vein, inferior labial artery or pterygoid venous plexus. So the infection which is spreading via lymphatics from the lower lip first enter the bloodstream at the brachiocephalic vein. Option A is the answer. Brachiocephalic vein. Coming on to 5. Pterygopalatine ganglion is functionally connected to which nerve? Facial nerve or mandibular nerve or glossopharyngeal nerve or maxillary nerve? Pterygopalatine ganglion is functionally connected to facial nerve. Okay. Option A. C. 6. Okay. Gamma antibodies are seen in liver, spleen, kidney or lungs. Very easy question. Gamma antibodies are seen in the spleen. Okay. Option B. Hemophilia is best treated by dried freeze plasma or factor 8 concentrate or whole body or cryoprecipitate. So how will you treat hemophilia? Hemophilia, there is always a deficiency of the clotting factor. So it is best treated by giving clotting factor 8. Okay, so option B is the answer. Question number 8. The mode of inheritance in hemophilia. Okay, so you know most of the times in hemophilia females are carriers and males are mostly affected. Okay, so the mode of inheritance is X-linked. Okay, X-linked dominant or X-linked recessive. That is a doubt, isn't it? So mainly it is X-linked recessive because that is why males are affected and females are carriers. X-linked recessive disorder. Question number 9. In which type of glycogen storage disease is hyperuricemia a feature? In which type of glycogen storage disease is hyperuricemia a feature? Glycogen storage disease 1 or 2 or 3 or 4 has got a hyperuricemia. Glycogen storage disease 1. Okay, 9A. Okay, so 1 is the answer. Question number 10. Malonyl aciduria is seen in the deficiency of pyridoxine or vitamin B12 or folic acid or riboflavin deficiency. Okay, malonyl aciduria is a characteristic feature in case of a deficiency with vitamin B12. Okay, malonyl aciduria. Coming on to question number 11. Hemolytic anemia is a feature of deficiency of all RBC enzymes except G6PD, pyruvate kinase, aldolase A and lactate dehydrogenase. Hemolytic anemia is a feature of deficiency in all of the RBC enzymes except is asked. Okay, so you have to rule out except in lactate dehydrogenase. Hemolytic, whenever there is a deficiency of G6PD, you will have hemolytic anemia. Whenever you have deficiency of pyruvate kinase also, you will have hemolytic anemia. Aldolase A deficiency also shows hemolytic anemia, but not lactate dehydrogenase. Okay, so 11D is the answer. Question number 12. Anaerobic bacteria can be cultured in which medium? LJ medium, Okay, Lowenstein-Jensen medium, that is LJ medium, Robertson cooked meat medium, or Loeffler's medium, or Sebarod's agar. Anaerobic bacteria can be cultured in B, Robertson cooked meat medium. Okay, anaerobic bacteria. Question number 13. Complement binding immunoglobulin via the classical pathway is, which is the pathway? Complement binding immunoglobulin is via the classical pathway is IgG and IgM, IgG and IgA, IgG and D, IgD and E. So the complement binding immunoglobulin via the classical pathway is IgG and IgM. Okay, it's a bit tough question, but you have to understand. Okay, IgG and IgM is the pathway through which the complement binds. G and M. Question number 14. Malignant pustule is referred to facio-cervical actinomycosis, cutaneous anthrax, infected squamous cell carcinoma, or none of the above. Malignant pustule. The term malignant pustule is referred to cutaneous anthrax. Okay, 14b, cutaneous anthrax. 15. Which of the following viruses appears to be involved in the pathogenesis of Kaposi sarcoma? 3, 1, 8 or 4. Okay. Which of the following virus? HHA, HHV 8. Okay. 15C. Kaposi sarcoma is connected to 8 number. Okay. 16. Which of the following is an opsonin? C3b, C3a, IgG or IgA. Which of the following is an opsonin? C3b. Okay. Opsonin. Okay. Which of the following is an opsonin? C3b is a opsonin. 17. Which periodontal fibers are consistent and are reconstructed even after the destruction of the alveolar bone? See, one of the periodontal fibers among the 4 options is very consistent. Even if you destroy the bone, there is a destruction of the bone, alveolar bone, this periodontal fiber is reconstructed. Apical or alveolar crest fibers or oblique fibers are transseptal fibers. Okay, transseptal fibers. These are the ones which are very, very consistent. Okay, transseptal fibers. 18. With a type of bone present in the interradicular area, cortical, cancellous, osteophytic or exophytic. The type of bone which is present in the interradicular area is a cancellous bone. Okay, between two tooth roots there will be cancellous bone. 19. Severe alveolar bone loss as observed in juvenile periodontitis is associated with cyclic neutropenia or lysis of the neutrophil or increased phagocytosis or neutrophil chemotactic defects or impaired neutrophil chemotaxis. Severe alveolar bone loss seen in juvenile periodontitis is associated with what? Associated with neutrophil chemotactic defect or impaired neutrophil chemotaxis results in what? Results in alveolar bone loss in juvenile periodontitis. Question number 20. A complex interaction among the lymphocytes, inflammatory cells and other cellular elements in connective tissue are mediated by a series of low molecular weight proteins called as bradykinin or histamine or cytokines or kallikrein. So the question is a very lengthy question, so you have to understand it once more. A complex interaction among lymphocytes, inflammatory cell and other cellular elements in the connective tissue are mediated by which protein? Okay, so the interaction in the connective tissue is mediated by which protein? It is mediated by cytokines. Okay, option C. 21. Wright's clinical classification of children's cooperative behavior has how many categories? Okay, 3, 4, 5 or 2. Okay, 3 categories. Wright's classification, clinical classification of children's cooperative behavior has got only 3 categories. 22. The failure of calcium hydroxide pulpotomy done on a primary first molar is due to internal resorption or external resorption or pulp calcification or pulp fibrosis. So most of the times when after doing a pulpotomy, calcium hydroxide pulpotomy for a deciduous tooth, it fails because of the internal resorption. Okay, 22A. Question number 23. Preventive pit and fissure sealant in children should have high compressive strength or low viscosity, hybrid composite with filler or none of the above. When you use a preventive pit and fissure sealant, what should be its quality? It should not be viscous. Okay, it should have very low viscosity. Only then it will prevent. Okay, only then it will act like a sealant, isn't it? So 23B. Question number 24. Commercially available KRI paste composition. What is the composition of KRI paste? Camphor, parachlorophenol, menthol, iodoform. Or it contains zinc oxide, eugenol, no. Calcium hydroxide plus iodoform, no. Calcium hydroxide plus iodoform plus camphor plus menthol. Okay, no. It is not, calcium hydroxide is not a part of KRI paste. Mainly it contains camphor, parachlorophenol, menthol and iodoform. Okay, option A is the answer. KRI paste consists of camphor, parachlorophenol, menthol and iodoform. Question number 25, Young's formula. So Young's formula always uses the age of the patient. Just remember that. Young's, okay, young, you are young or you are old. It is depending upon your age. Remember that way. So the option D, you can directly go into option D, but in otherwise you have to check what is the formula being given. It is age into adult dosage divided by age plus 12. Okay, clear? Age into adult dosage by divided by age plus 12. 26. Which of the following premolar has a mesial marginal ridge which is more cervically placed than the distal marginal ridge? Maxillary first molar or maxillary second premolar or mandibular first premolar or mandibular second premolar? Definitely it is in mandibular tooth, but whether it is first premolar or second premolar, it is in first premolar. 26C. Mandibular first premolar, the mesial marginal ridge is cervically placed compared to distal marginal ridge. Question number 27. Articular disc of TMJ is made up of what? Articular disc of the TMJ is made up of elastic cartilage or fibrocartilage of bony process or fibrous ligament and hyaline cartilage only. So, it is made up of fibrocartilage. Articular disc is made up of fibrocartilage, okay, of TMJ. 28. The term connectors or interdental contact area refers to what? The contact point between the adjacent anterior teeth, contact point and the area above and below the contact point between the adjacent teeth, contact point between the adjacent posterior teeth, embrasures incisal and gingival to the contact area. So, the most ideal definition of a interdental contact area or connector is a contact point and the area above and below the contact point between the adjacent teeth. You shouldn't mention anterior or posterior. In case of anterior as well as posterior, you have this contact area, isn't it? So option B is the answer. Question number 29. Trapezoidal outline with smallest uneven surface occlusally seen in. The trapezoidal outline, occlusal outline is trapezoidal in shape. So the options are proximal surface of the permanent maxillary molar, proximal surface of the permanent mandibular molar, buccal surface of all the posterior teeth, buccal and inguinal surface of the anterior teeth. In case of a permanent maxillary molar, the proximal surface will be more trapezoidal outline with smallest uneven surface. Okay, so option A is the answer. The proximal surface of the permanent maxillary molar will be a trapezoidal outline, okay, with smallest uneven sides. Question number 30. Y-shaped developmental grooves. Okay, Y-shaped developmental grooves are seen in mandibular first molar or mandibular second premolar or maxillary first molar or maxillary second premolar. It is seen in mandibular second premolar. Okay, Y-shaped developmental groove seen in mandibular second premolar. Question number 31. In Truncke-Collins syndrome, there is upward sloping of the palpebral fissure, poorly developed or absence of malar bones, progynia and mandibular prognathism, no loss of hearing. So, the correct answer is in Truncke-Collins syndrome, there is poorly developed or absence of malar bones. Okay, 31B. 32. Brittle bone syndrome is caused by improper synthesis of procollagen. That is true, correct. Polymerization of collagen, no. There is increased osteoclastic activity, no. Increased fibroblastic activity, no. Mainly the pathogenesis of brittle bone syndrome is mainly in the improper synthesis of the procollagen. Okay, 32A. Which of the following condition is not considered as pre-malignant? Erosive lichen planus, like syphilitic glossitis, leukedema or leukoplegia. Definitely leukedema is not a pre-malignant condition. 34. A storiform pattern of fibrous tissue is seen in. So they are asking histologically storiform pattern is seen in which disease? Fibrosarcoma, or it is seen in malignant fibrous histiocytoma, neurofibroma, aminoblastic fibroma. Okay, the storiform pattern of fibrous tissue is seen in malignant fibrous histiocytoma. Okay, storiform pattern of fibrous tissue is seen in malignant fibrous histiocytoma. Okay. Clear cells are seen in chondrosarcoma, osteosarcoma, fibrosarcoma, Ewing sarcoma. Clear cells are seen in chondrosarcoma. Okay, clear cells are seen in chondrosarcoma. Clear cells are seen in chondrosarcoma. 36. Granularity of oncocyte is due to overabundance of the Golgi bodies, overabundance of the mitochondria, deficiency of mitochondria, or deficiency of Golgi bodies. Granularity of the oncocyte is due to overabundance of the mitochondria. 36b. 37. Waters projection is useful for evaluating frontal and ethmoidal sinuses, zygomaticofrontal suture and nasal cavity, maxillary sinus, all of the above. Waters projection can be used for all of the three options given above. So 37d. Question number 38. Of the following, which is best projection to study the fracture of a zygomatic arch? Lateral oblique view, or PA Carvel view, or a submental vertex view, or lateral cephalo view? So among the given options given, the best studied, if you want to study the fracture of a zygomatic arch, you go for a submental vertex view. 38C. Full mouth X-ray contains, this is easy question. Full mouth X-ray means 17 IOP you have to take and 4 wide bite wing you have to take. So 39B. 17 IOP and 4 bite wing. Question number 40. What is the minimum amount of taper that should be maintained for an ideal tooth preparation? For an ideal tooth preparation, the tapering must be how much degrees? It must be 4 degree, 5 degree, 6 degree, 12 degree. So for ideal tooth preparation, the tapering is almost 12 degree, 40D. What is the amount of occlusal reduction required for a metal ceramic facing on a non-functional cusp? So if you are giving a metal ceramic crown, and how much you have to reduce the occlusal surface in the non-functional cusp area? You have to reduce around 0.5 to 1 mm. No much reduction is required here. Okay, 0.5 to 1 mm. Okay. 42. The length of dowel must be equal to the crown length, 1/3 the root length, half the root length, none of the above. So the length of the dowel is most of the times equal to the crown length. Okay, equal to crown length. 43. A distal extension partial denture receives its supports from the terminal abutment or equally from abutment and residual ridges, mostly from the residual ridges, exclusively from the residual ridges. A distal extension partial denture receives its support mostly from the residual ridge. Okay, mostly from a residual ridge. Okay. 44. Which part of the distal extension removable partial denture provides the greatest resistance to movements and torquing of the abutment teeth? So there is a distal extension RPD, and which part will give greatest resistance? Rest part or base part or retentive clasp or minor connector? Among the given option, the base will give a very good resistance. 45. Terminal component of a clasp end is shaped as a what? What is the terminal part of your body? Arm, isn't it? Arm with fingers. So the terminal component of a clasp is arms. Okay, arm. 46. Auxiliary rest are direct retainers, indirect retainers, all of the above, none of the above. Auxiliary rest are actually indirect retainers. 46B, indirect retainers. 47. The use of stress breaker in modern dentistry is avoided because it affects the abutment more, it affects the alveolar ridge, it affects both abutment and alveolar ridge, none of the above. So why don't you use a stress breaker in modern dentistry? Because it will affect which part? It will affect the alveolar ridge mainly. Okay, that is why you don't use a stress breaker. 48. Which joint is present between a major and minor connector of an RPD? Acute ball and socket, obtuse or butt joint. That is a very easy question. The joint between major connector and minor connector is a butt joint. 49. Which of the following cement is most irritant to pulpal tissue? Zinc, phosphate or silicate or glass ionomer or polycarboxylate? The most irritant among the given option is a silicate cement. Okay, 49B. The most important cause for marginal failure of an amalgam restoration: increased creep or decreased strength or tarnish and corrosion, delayed setting of the material. So most of the times the reason for failure of amalgam restoration is increased creep. Okay, 50A. Question number 51. The particle size in microfilled composite is 0.02, 0.04, 0.5 to 1, 0.04 to 0.4, 0.3 to 0.4. The particle size in a microfilled composite is very small, 0.04 to 0.4 microns. Okay, 51C. The particle size in a microfilled composite is 0.04 to 0.4 microns. Okay, particle size. The value of C factor for class 4 composite restoration is, what is the value of C factor for class 4 composite restoration? 0.25, 0.51 or 2? Okay, it is 0.25. 0.25, 52A. The value of C factor for class 4 composite restoration is 0.25. Question number 53. Short bevel extends in almost 2/3 of the enamel, all of the enamel and half of the dentine, all of the enamel, only 1/3 of the enamel. Short bevel extends all of the enamel. Only in the enamel you can see the bevel. Okay, not in dentine part. Okay, so short bevel extends only in the enamel area. Okay, 53C. Okay, clear. 54. Back porosity. Back pressure porosity can be avoided by using asbestos liner, placing the sprue at least 1/4 inch away from the end of the casting ring, preventing a rapid heating of the investment using a short and wide sprue. Back pressure porosity is avoided by placing the sprue at least 1/4 inch away from the end of the casting ring. So the placement of sprue is important. It should be placed at least 1/4 inch away from the end of casting ring, otherwise you will end up in back pressure porosity. 55. Which of the following instrument will have a 4-number formula? Very easy question. GMT has got 4-number formula. 55B. Okay. 56. In which of the condition piggyback wedging is you indicated? Okay, piggyback, you give a piggyback wedging when? Whenever there is a proximal caries with gingival recession. Yes, that option is correct. Tooth with fluted surface? No. Class 2 with wide proximal box? No. Narrow class 2 cavity. Okay, whenever you have gingival recession, you have to go for piggyback wedging. Okay. 56A. 57. What is a ferrule? Pin retain restorative preparation. Secondary retentive feature for an amalgam restoration. Band encircling external dimension of the tooth. What is a ferrule? Is actually a band, isn't it? And this band is encircling the external dimension of the tooth. So ferrule is band encircling external dimension of the tooth. C. What is 58 question? Right rear operator position refers to. Wow, this question is easy. Right rear operator means what? The one near to the, very close to the head of the patient. So it is 11 o'clock position. Right rear operator position refers to 11 o'clock position. Okay. Okay. Now 59. Microfracture occurring in the cervical area of a tooth under flexural load is known as abrasion. No. Attrition. No. Effraction. Yes. Microfracture occurring in the cervical area of a tooth under flexural load is known as effraction. Okay. Coming on to question number 60. In a diagonodent, the instrument reading of what range will suggest a dental caries? You're using a diagonodent to identify the dental caries. So what will tell you, what reading will tell you that the patient is having dental caries? Okay, 20 to 25. So the reading, as soon as it reaches between the range of 20 to 25, you can definitely say the patient is having dental caries regarding the tooth. Okay. D. Question number 61. Which of the following is an excavator, GMT, angle former, enamel hatchet, wedge, sledge chisel? Okay, which is a excavator? The one which is a excavator among the given option is actually a angle former. Okay, angle former can be used as a excavator. Angle former. 61B. The fourth root canal, if present in the maxillary first molar, is usually present in the mesiobuccal, isn't it? MB1, MB2. Okay, that is why MB2 root canal finding is very important. Okay. 63. Nerve fibers in the pulp are sympathetic efferent postganglionic fibers, parasympathetic postganglionic fibers, motor fibers, both autonomic parasympathetic and sympathetic fibers. Nerve fibers in the pulp are sympathetic efferent postganglionic fibers. Okay, 63A. Nerve fibers in the pulp are sympathetic. Okay, because they carry the impulses. They are efferent. Okay, not efferent, they are efferent postganglionic. Okay, so they are efferent and they are postganglionic, they are sympathetic nature. 63A. Recently used irrigation solution, MTAB, MTAC, MTAD or MTAA. What is the irrigation solution commonly used? MTAD. Okay, 64C. MTAD is the irrigation solution. 65. The super elastic property of night tie wire is due to the stress induced phase transition from austenitic to martensitic phase, temperature induced phase transition from martensitic to austenitic, stress induced phase transition or temperature induced phase transition. Okay, so they are asking about what is the factor related for the super elasticity property of night tie wire. Okay, it is mainly the stress induced. Whenever there is a stress, there is a transition of from austenitic to martensitic phase. Okay, so whenever there is a transition from austenitic to martensitic phase, that too under stress condition, you will that is the property which is indicating the super elastic property of night tie wire. Okay, 65A. 66. MTA is used for epexification only of any dentition, epexification of primary teeth only, epexification of permanent tooth only, epexogenesis of any dentition. MTA is used for epexogenesis of any dentition. Okay, 66D. You can use for permanent dentition as well as for deciduous dentition, but it is mainly used for epexogenesis, for the root formation. Okay, whenever if the root apex is not fully formed for a young erupted tooth, you can give MTA whether it is permanent or it's a deciduous tooth. Okay, 67. Till what age tetracycline should not be given to prevent discoloration? As you know, if the mother is having tetracycline, the child tooth will have tetracycline staining. But even after the birth of the baby, you are not supposed to give tetracycline to the child until he or she is 8 years old. Okay, because most of the tooth formation will happen within 8 years. So until 8 years you should not give tetracycline because it will cause discoloration of the enamel. Okay, 67B. 68. Apical transportation is also known as what? Okay, it's also known as curing, zipping, ledging or apical perforation. Apical transportation is also known as zipping. Okay, zipping. 68B. Root end conditioning is done by citric acid, orthophosphoric acid, formaldehyde, calcium hydroxide. Root end conditioning is done by citric acid. Citric acid. Root end conditioning is done by citric acid. Okay. 69A. Root end conditioning is done by citric acid. 70. Rubber dam was given by, very easy question, rubber dam was discovered by S.C. Barnum. Okay, 70C. 71. The following adverse effect of penicillin is dose related: skin rashes, interstitial nephritis, drug fever, encephalopathy. So when you have penicillin, what is the one which is related to the dosage? Adverse effect. Okay, encephalopathy. If you have higher doses of penicillin, you will end up in encephalopathy. Okay, 71D. Coming on to 72, the antidote for heparin is protamine sulfate. Okay, you have to by heart that. What is the antidote for heparin? It is protamine sulfate. 73. A patient is allergic to succinylcholine. The muscle relaxant of choice for this patient is. So most of the times you can give succinylcholine for muscle as a muscle relaxant. But if the patient is allergic to succinylcholine, what will you give? So if the patient is allergic, you have to go for rocuronium. Okay, 73B. Rocuronium. Okay, rocuronium. Which drug among the following does not inhibit platelet aggregation? Aspirin, celecoxib, ibuprofen, clopidogrel. Which drug among the following does not inhibit platelet aggregation? So aspirin will cause it will inhibit platelet aggregation. That is the main function of aspirin. Celecoxib, yes, celecoxib. Celecoxib does not inhibit platelet aggregation. Okay, celecoxib is the answer. 75. All are true of paracetamol poisoning except acetylcysteine is antidote. Yes. Asymptomatic for 24 to 30 hours. No. 10 milligram is safe dose. Yes, 10 milligram is a safe dose for paracetamol. Acetylcysteine block glutathione in paracetamol poisoning. Yes, acetylcysteine block glutathione in paracetamol poisoning. That is correct. So what is not true? It is not asymptomatic for 24 to 30 hours if you have a paracetamol poisoning. Okay. 76. The simplest alloy is a solid solution. Eutectic alloy, peritectic alloy, ternary alloy. Okay. So the simplest alloy is actually a solid solution. Simplest alloy is a solid solution. Okay. 76A. The elastomer having the longest curing time. Polysulfide, polyether, addition silicon, condensation silicon. The one with highest longest curing time is polysulfide. Okay. 77A. Polysulfide has got a high curing time. Okay. Elastomer having a longest curing time is polysulfide. 70. The most commonly used accelerator in gypsum product. Sodium fluoride, potassium sulfate, aluminum sulfate. Yes, potassium sulfate is the accelerator in gypsum product. Potassium sulfate. Okay, potassium sulfate is the accelerator in gypsum product. 79. Hanau H2 articulator has an intercondylar distance of 90 mm, 100 mm, 110 mm or 120 mm. 79. C. 110 mm. Okay. Hanau H2 articulator has got an intercondylar distance of 110 mm. That is a difference intercondylar distance. Question number 80. Osho integration was first defined by which scientist? Both and co-workers, Greenfield, Strock or Brainmark? So it was first defined by Brainmark. Okay. Osho integration was first defined by Brainmark. 81. The distance between two edges in implant should be 2 mm, 3 mm, 4 mm, 5 mm. The minimum distance between two implants should be 3 mm. Okay. So at least 3 mm distance should be there. Okay, clear. 82. Wilson curve is anterior posterior curve or sagittal curve or mesiodistal curve or lingual inclination of the maxillary molar. It is a mesiodistal curve. Wilson curve is a mesiodistal curve. Question number 83. During cap stage signaling in odontogenic epithelium is done by dental follicle, enamel knot, dental papillary, inner enamel epithelium. So during the cap stage, the signaling in odontogenic epithelium is done by the enamel knot. Okay. 83B. 84. The most accepted theory for dentine sensitivity, transduction theory, direct nerve stimulation, hydrodynamic theory, hydrostatic theory. It is hydrodynamic theory, isn't it? The most sensitivity theory is hydrodynamic theory. 85. The maximum fluoride content is seen in dental cementum or dental pulp or enamel or dentine. So with age, advancing age, the cementum will have very high fluoride. So the cementum is the one. 85A. Maximum fluoride content is seen in cementum and it increases with age. 86. The glands of Plantin and Nuhin are the posterior lingual glands, anterior lingual glands are located near the apex of the tongue, glossopalatine glands, palatine glands. Okay. So they are actually the anterior lingual glands located near the apex of the tongue. Okay. Plantin and Nuhin are seen near the apex of the tongue. 87. The most accepted theory of tooth eruption, hydrodynamic, clone theory, periodontal ligament traction theory, vascular theory. Easy question. The most accepted theory of tooth eruption is periodontal ligament traction theory. 88. The striae of Retzius represents externally on the surface of the tooth as Nasman's membrane, perikymata, neonatal line or enamel cuticle. So the striae of Retzius is represented externally as perikymata. 88B. Non-parametric test used to compare the medians of two independent samples. So two independent samples are given. You are taking the median of both the independent samples. Then you are doing a comparison between the two medians. So for that you have to go for which test? Mann-Whitney U test. Okay, you are comparing the medians. You have to go for Mann-Whitney U test. Okay, 89C. In gingival index, score 2 means what? Bleeding on slight provocation or spontaneous bleeding or color change in gingiva? No change in gingiva. Score 2 in gingival index is actually a bleeding on slight provocation. 90A. When you have a slight provocation, you are having a bleeding. So that is score 2. Okay. 91. The community periodontal index for treatment need is recorded for, that is CPITN is recorded for quadrant, sextant, one arch, whole dentition. So similar question we have done in a model paper previously. So in that we were asking about the definition of CPITN. Here what is its recording purpose? 91B, sex sense. Okay, it is actually recorded for sex sense. The community periodontal index for treatment, it is recorded for sex sense. 92, the WHO index for fluorosis is based on Dean's index, Mackay's index, community fluorosis index, or public health fluorosis index. The WHO index for fluorosis is based on Dean's index. Okay, Dean's index. Based upon Dean's index, we have WHO index for fluorosis. 93, following foramina are found in the greater wing of sphenoid except, they're asking except, where foramen rotentum is present in the greater wing of sphenoid? Yes. Canaliculus innominatus is also present in the greater wing of sphenoid. Foramen spinosum is also present in the greater wing of sphenoid, but optic canal is not present. So option D is the answer. Okay, in such questions you have to rule out the anatomy. Okay, choose the odd one by ruling out the other options. Question number 94. Which of the following is weakest part of the orbit? Median wall or lateral wall, floor of the orbit or roof of the orbit? So the median wall is almost very weakest part of the orbit. Whenever you have a blowout fracture, the median wall of the orbit is the one which fractures mostly. So the near to the nose, the wall part which is near to the nose nasal bridge. So median wall is the weakest part of the orbit. Question number 95. Ptosis is due to damage to oculomotor nerve, abducens nerve, trochlear nerve, facial nerve. Ptosis is damage to oculomotor nerve. 95A. Okay. 96. The specific gravity of transudate is below 1.010, below 1.012, between 1.012 and 1.020, above 1. This you have to by heart. The specific gravity of transudate is below 1.012. Okay. So it is below 1.012. 97. The bar bodies associated with metaphase or interface or anaphase or prophase. The bar bodies associated with a interface, isn't it? Interface. Bar bodies associated with interface. 98. Craniofacial dissociation is seen in which fracture? Lefort 1, 2 or 3? Craniofacial dissociation is seen in Lefort 3 fracture. Okay, Lefort 3 will show you the entire dissociation of the cranial region. Okay. Question number 99. Inulin clearance closely resembles GFR, renal plasma flow, creatinine clearance, or PAH clearance. Inulin clearance means what? Inulin clearance means GFR clearance. Okay, option A, GFR clearance. Last question. Okay, 100th question. Stimulation of the baroreceptor will result in increase in heart rate, in decreased vagal discharge, increased sympathetic discharge, or decrease in the blood pressure. Stimulation of the baroreceptor will result in decrease in the blood pressure. Okay, baroreceptors are for blood pressure. Okay, so pressure sensors. So baroreceptor stimulation will decrease the blood pressure. Okay, so with this we come to the end of 100 questions. I hope all of you will revise these question papers. It is very easy. If you revise, you will be able to quickly go through almost all the syllabus part which is required for the PSC exam as well as for the NEET MDS exam. Okay, so hope all of you will revise these question papers. If you want more question papers like these, please comment down below the video, and also if you have any doubts regarding any of the question explanation required, you can also ask them in the comments and I will reply soon. Okay, thank you so much. Bye bye.